People on the streets, frozen or barely moving, as the drug takes hold. In some towns and cities across the United States, you don't have to look far to see what fentanyl is doing. A synthetic opioid like fentanyl is now the deadliest drug in the US. It's cheap, highly potent, and often taken unknowingly. But what exactly is it? Why is it so deadly? And can anything be done to stop it? Fentanyl is a synthetic opioid made from a combination of chemicals, and it's up to 100 times stronger than morphine. It was first developed in the 1960s as a powerful anesthetic and painkiller. It's still used legally in hospitals to treat patients with severe pain, including cancer. But by the 1990s, a wave of overprescription had begun.
Sometimes describe this as the three waves of the opioid overdose epidemic, where it started with prescription opioids, then it shifted to more non-prescribed opioids, and then we got into the synthetic opioids of the fentanyl, which has really unfortunately exponentially increased opioid overdose deaths because it's so potent and so dangerous.
Now the drug epidemic is driven by counterfeit pills and illicit supply, and it's widespread across the United States. Fentanyl is often mixed with other drugs and sold as powder, pills or nasal sprays. Just 2 milligrams, about the size of a few grains of salt, can be fatal. In 2024, US Drug Enforcement Administration tests found that half of the fentanyl-laced fake pills contained a potentially lethal dose. Pills are cheap, often selling for $1. Dealers advertise on social media. Transactions happen quickly and discreetly, and in some cases people have no idea what they're taking contains fentanyl.
So in 2018, my 32-year-old daughter was suffering from a medical issue, pancreatitis. It's very painful. She had a medication that she rarely used for pain, and one late night Sunday evening, she did not have this medication, and someone that she trusted and loved gave her what looked like a prescription pill. Ashley took half of that pill, and it took her life almost instantly. Ashley didn't know about illicit fentanyl. She had never heard of it. She didn't know the dangers. The person that gave her this pill also didn't know about fentanyl and didn't know the dangers.
The US Drug Enforcement Administration says most illicit fentanyl is produced in Mexico using chemicals shipped from China and India. Cartels manufacture the pills and powders, then smuggle them into the US using increasingly sophisticated methods. The COVID-19 pandemic made things worse, isolating users and overwhelming services. In 2021, overdose deaths passed 100,000 for the first time, driven in part by synthetic opioids like fentanyl. After losing her daughter to the drug, Andrea Thomas set up an awareness foundation that spreads the word about the danger of fentanyl.
We need to speak with our families and let them know, speak with our young people, let them know that they should never take anything that's not been prescribed to them and purchased in a legitimate pharmacy. These drugs are very deceptive. They look real, and they aren't, the street drugs aren't the drugs that were there 10 years ago. They're deadly, they're powerful.
But why is it so hard to quit? Fentanyl works like heroin, but it's 50 times stronger. It binds to the brain areas that control pain and triggers a surge of dopamine, the chemical that controls pleasure and reward. That's what causes the high.
That then develops into something called an opioid use disorder, also known as addiction, that really perpetuates that compulsive drive to continue to use the substance.
US efforts to defeat fentanyl span multiple administrations. President Biden declared fentanyl trafficking a national emergency in 2021. President Trump imposed new tariffs on China, Mexico, and Canada and tightened border security.
The solution is really going to have to be multi-pronged, and we know that one of the key solutions really has to be increased access to effective treatments, and we are still struggling in the United States to get effective treatments.
In 2024, more than 48,000 Americans died from overdoses involving synthetic opioids. mostly fentanyl. And while total overdose deaths have begun to fall, fentanyl remains the deadliest.